Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This presentation is appropriate for content overview and clinical competency. It will cover arterial blood gases and acid-base imbalances. Please note that this presentation is intended as a quick overview of ABGs and how to interpret basic lab values. For our scenarios, we will consider carbon dioxide to be acidic and bicarbonate to be alkaline. This presentation will use basic terminology. For a more in-depth understanding of ABGs, additional research and study are recommended. The ability to read and understand arterial blood gases, ABGs, provides you with a lot of helpful information about your patient. An acid-base imbalance occurs when your patient's ABGs are no longer balanced in the normal range. This presentation will cover imbalances of pH, identifying respiratory and metabolic imbalances, recognizing partial and full compensation. The method used is the Pegasus method, which is the blood gas bullseye. For this method, you will use arrows and O to represent the bullseye. What are blood gases? A lab draw for arterial blood gases requires a sample of blood drawn from an artery to determine levels of gases in the blood as well as the pH of the blood. Although the pH actually is a measure of how acidic or alkaline the blood is, it is added to the following chart of lab values. You must know the pH to determine if the patient is in acidosis or alkalosis. This chart shows you arterial blood gases in the normal range. For the pH, we have 7.35 to 7.45. The PaCO2 is 35 to 45, and the HCO3 is 21 to 28. Those are the three we're going to focus on as we interpret ABGs. There are a lot of tips and tricks and games to reading blood gases to determine acid-base imbalances, but it doesn't take a trick to determine if the imbalance is acidosis or alkalosis. Just read the pH. The pH indicates if the blood is more acidic or alkaline, basic. The normal range for the pH is 7.35 to 7.45. You'll see on our chart that the normal range is in green. Everything below that we'll consider acidosis, and everything above that will be alkalosis. We will use arrows up or down for the pH and understand that if the other gases hit the bullseye in the normal range, we cannot consider an acid-base imbalance, and we will not interpret the labs as acidosis or alkalosis. Although it may be in the normal range of 7.35 to 7.45, start in the middle at 7.4 to read the pH. For our scenarios, we are anticipating an acid-base imbalance, so consider a pH below 7.4 as acidosis and a pH above 7.4 is alkalosis. Yes, even if it is in the normal range for this scenario. Please note that the normal range is 7.35 to 7.45. We are only using 7.4 as a reference point for reading ABGs in the scenarios for this presentation. You'll notice on this graph that 7.4 falls right in the middle of the normal range. But again, everything below that we're going to consider acidosis. Everything above that we'll consider alkalosis. Let's get started. Remember, start with your baseline pH of 7.4. If the pH is lower than 7.4, put an arrow down, and if it is above 7.4, put an arrow up. The following are practice examples. A pH of 7.45, this is above 7.4, put an arrow up. We know the imbalance is alkalosis. A pH of 7.29, we know that is below 7.4. We put an arrow down. We know the imbalance is acidosis. A pH of 7.31, that is below 7.4. We put an arrow down. We know the imbalance is acidosis. A pH of 7.39 is below 7.4. We put an arrow down and we know the imbalance is acidosis. A pH of 7.5 is above 7.4. We put an arrow up and we know the imbalance is alkalosis. And a pH of 7.41 is above 7.4. Put an arrow up and we know the imbalance is alkalosis. Now that we know how to determine whether our patient's pH indicates acidosis or alkalosis, let's look at another blood gas. The PaCO2 is a measurement of the respiratory component of ABGs. PaCO2 measures carbon dioxide in the blood. For our scenarios, we will consider carbon dioxide as acidic. If your patient has a respiratory issue that results in increased PaCO2, it makes sense that the pH would become more acidic and the pH would go down. If your patient has a respiratory imbalance then has a decreased PaCO2, it makes sense that the blood pH would become less acidic and the pH would go up. As mentioned in the previous slide, the PaCO2 is a measurement of the respiratory component of ABGs. PaCO2 is a measure of the respiratory system's ability to remove carbon dioxide or CO2 from the blood. Remember, consider this gas as acidic, and there is an inversely proportionate relationship between the pH and the PaCO2. That means when the PaCO2 goes up due to a respiratory issue, the pH will go down. And when the PaCO2 goes down due to a respiratory issue, the pH will go up. These graphs show it a little more clearly. If your patient has too much carbon dioxide from depressed respiration, impaired gas exchange, etc., it makes sense that their blood would become more acidic. That means when their PaCO2 goes up, as in the first chart, their pH goes down to indicate acidosis in the second. If your patient has too little carbon dioxide, which is an acid, from increased respiration, hyperventilation, etc., it makes sense that their blood would become less acidic. That means when their PaCO2 goes down, they have less acid. You'll notice on the first graph, that's the PaCO2 with the green in the normal range. When you have less PaCO2, it's less acidic and your pH goes up to indicate alkalosis. Now that you know how to determine whether your patient's pH indicates acidosis or alkalosis, and we understand the relationship between the PaCO2 and the pH, let's look at another blood gas. The HCO3 is a measurement of the metabolic component of ABGs. HCO3 is the formula for bicarbonate. Bicarbonate is a buffer. For our scenarios, we'll consider HCO3 to be alkaline or basic. If your patient has a metabolic imbalance and has an elevated HCO3, it makes sense that the blood pH would become more alkaline. As mentioned on the previous slide, the HCO3 is a measurement of the metabolic component of ABGs. HCO3 is the formula for bicarbonate. This graph is going to show you the bicarbonate normal range, which is indicated in green. This gas is alkaline, and there is a directly proportionate relationship between the pH and the HCO3. If your patient's bicarbonate level, which is a base, is high from a loss of acid, certain diuretics, a loss of potassium, etc., it makes sense that their blood would become more alkaline, basic. That means when their HCO3, which is a base, goes up, as indicated in the first graph, their pH goes up to indicate alkalosis. The more base you have, the more basic your blood becomes. If your patient's bicarbonate level, which is a base, is low from kidney disease, diarrhea, ketoacidosis, etc., it makes sense that their blood would become more acidic. That means when their HCO3, which is a base, goes down, as indicated in that first graph, their pH would go down as well to indicate acidosis. The less base you have, the less basic your blood pH becomes. Now that we understand how to read the pH to determine acidosis and alkalosis, recognize the inversely proportionate relationship between the PaCO2 and the pH, recognize the directly proportionate relationship between the HCO3 and the pH, we can put it all together to determine which system is causing the imbalance. We will use the acronym ROME to help us determine if the imbalance is a respiratory problem or a metabolic problem. It's a respiratory problem if the respiratory gas goes opposite the pH. So we're going to compare the respiratory gas to the pH. If the respiratory gas goes in the opposite direction of the pH, it's a respiratory problem. It's a metabolic problem if the metabolic gas goes equal or the same way as the pH. We're going to compare the metabolic gas to the pH. If the metabolic gas goes in equal or the same direction, we know it's a metabolic problem. We will compare the respiratory gas and the metabolic gas to the pH to determine which imbalance is present. Although your patient could have comorbidities that cause acidosis and alkalosis, for our scenario, only one of these will be true. The respiratory gas will go opposite to pH, or the metabolic gas will go equal or the same direction. To determine acid-base imbalances with this method, just use arrows. List your labs, put an arrow up or down for the pH. To identify acid-base imbalances, you must use an arrow up or down for the pH, even if it is technically in the normal range. We are first just going to look at the pH to determine if our patient has acidosis or alkalosis. There's no trick to this part. If your pH is high, use an arrow up for the pH to indicate alkalosis. If your pH is low, use an arrow down for the pH to indicate acidosis. We will look at the other labs after we determine the pH. Let's practice this again. Remember, start with our baseline pH of 7.4. If the pH is lower than 7.4, put an arrow down. If it's above 7.4, put an arrow up. The following are practice examples. We have a pH of 7.25, that's down. It indicates acidosis. We have a pH of 7.49, that's up. It indicates alkalosis. We have a pH of 7.33, that is down. It indicates acidosis. A pH of 7.5, it is up. It indicates alkalosis. A pH of 7.39 is down. It indicates acidosis. And a pH of 7.41 is up. It indicates alkalosis. There are a lot of tips and tricks for understanding and interpreting ABGs, but we're going to use the Pegasus method. This is the blood gas bullseye method. After you put an arrow up or down for the pH, to determine if the imbalance is acidosis or alkalosis, look at the PaCO2 and the HCO3. If they're high, well, we've missed our mark, put an arrow up. If they are low, again, we've missed our mark, put an arrow down. And if they're normal, put a 0. That's our bullseye. You must put an arrow up for alkalosis, an arrow down, which is acidosis, for the pH. Use an up arrow, a down arrow, or a 0 for the bullseye for the PaCO2 and the HCO3. If you end up with a 0, a bullseye, for your PaCO2 or for the HCO3, there is 0 or no compensation. Let's interpret some labs using the Pegasus bullseye method. Our patient has a pH of 7.36. That is below 7.4, so we put an arrow down. Look at the pH. The arrow's down. Congratulations, we've determined that the imbalance is acidosis. Now we look at the respiratory and metabolic gases. The PaCO2 is 49. The normal range is 35 to 45. So 49 is high, we put an arrow up. The HCO3 is 26. The normal range is 21 to 28. This is normal, so no arrow, it hit the bullseye. Use the acronym ROAM. The respiratory gas is going opposite of the pH, so we know this is a respiratory imbalance. Our interpretation is respiratory acidosis. Now let's check for compensation. Since our metabolic gas is in the normal range and we have a bullseye, oh, there is no compensation. For this patient, the pH is 7.36. It's below 7.4, arrow down. Look at the pH, the arrow is down. So congratulations, we've determined the imbalance is acidosis. Now we look at the respiratory and metabolic gases. The PaCO2 is 39. The normal range is 35 to 45. This is normal. We hit the bullseye. No arrow up or down. We need an O. The HCO3 is 18. The normal range is 21 to 28. So 18 is low. We put an arrow down. Now we use the acronym ROAM. The metabolic gas is going equal or the same way as the pH. So we know this is a metabolic imbalance. Our interpretation is metabolic acidosis. Now we need to check for compensation. Since our respiratory gas is in the normal range and has a bullseye, we know there is no compensation. This patient has a pH of 7.44. Well, this is above 7.4. We put an arrow up. Now look at the pH. The arrow is up. Congratulations! We have determined the imbalance is alkalosis. Now we look at the respiratory and metabolic gases. The PaCO2 is 30. Well, the normal range is 35 to 45. 30 is low, so we need to put an arrow down. The HCO3 is 23. The normal range is 21 to 28. 23 is normal, so no arrow. We have a bullseye. Now we use the acronym ROAM. The respiratory gas is going opposite the pH. We know this is a respiratory imbalance. Our interpretation is respiratory alkalosis. Now we need to check for compensation. Since our metabolic gas is in the normal range and has a bullseye, we know there is no compensation. So our interpretation of these labs are respiratory alkalosis without compensation. Let's keep practicing. We have a pH of 7.44. This is above 7.4. Put an arrow up. Look at the pH. The arrow is up. Congratulations, we've determined the imbalance is alkalosis. Now we look at the respiratory and metabolic gases. The PaCO2 is 40. The normal range is 35 to 45, so 40 is normal, no arrow. HCO3 is 30. The normal range is 21 to 28, so 30 is high, so we put an arrow up. Now we use the acronym ROAM. The metabolic gas is going equal or the same way as the pH, so we know this is a metabolic imbalance. Our interpretation is metabolic alkalosis. Now let's check for compensation. Since our respiratory gas is in the normal range and has a 0, there is no compensation. Our interpretation is metabolic alkalosis without compensation. Our practice so far has indicated that no compensation has occurred. Compensation occurs when an acid-base imbalance by either the respiratory or metabolic system changes the pH and the other system tries to compensate to move the pH back to normal. If the respiratory system causes an imbalance in the pH, then the metabolic system might try to compensate to correct the pH. If the metabolic system causes an imbalance in the pH, then the respiratory system might try to compensate to correct the pH. Let's practice with a new set of labs. We have a pH of 7.36. This is below 7.4, so we put an arrow down. Congratulations, you've determined that the imbalance is acidosis. Now that we know it's acidosis, we look at the respiratory and metabolic gases and use the acronym ROAM to determine if it is a respiratory or metabolic imbalance. The PaCO2 is 49. Well, the normal range is 35 to 45, so 49 is high, put an arrow up. The HCO3 is 33. The normal range is 21 to 28, so 33 is high, we put an arrow up. Now we're going to use the acronym ROAM. It is a respiratory problem if the respiratory gas goes opposite the pH. It is a metabolic problem if the metabolic gas goes equal or the same direction as the pH. The respiratory gas is going opposite the pH. Your interpretation is respiratory acidosis. Now let's check for compensation. We've already determined it's respiratory acidosis, so we'll look at the metabolic gas to determine if compensation is occurring. There is metabolic compensation because although it's not a metabolic problem, the metabolic gas is not in the normal range. Remember, if it was a metabolic problem, the metabolic gas would go the same way as the pH. So congratulations, we've determined that the imbalance is respiratory acidosis with metabolic compensation. Some more practice. We have a pH of 7.46. That's up because it's above 7.4. Congratulations, we've determined that the imbalance is alkalosis. Now that we know it's alkalosis, we look at the respiratory and metabolic gases and use the acronym ROAM to determine if it is respiratory or metabolic imbalance. The PaCO2 is 29. Well, the normal range is 35 to 45, so 29 is low, we put an arrow down. The HCO3 is 16. The normal range is 21 to 28, so 16 is low, we put an arrow down. Now we use the acronym ROME to determine if it's a respiratory or a metabolic problem. The respiratory gas is going opposite the pH, so our interpretation is respiratory alkalosis. Now let's check for compensation. We've already determined it's respiratory alkalosis, so we will look at the metabolic gas to determine if compensation is occurring. There is a metabolic compensation because although it is not a metabolic problem, the metabolic gas is not in the normal range. Remember, if it was a metabolic problem, the metabolic gas would have gone the same way as the pH. So congratulations, we've determined that the imbalance is respiratory alkalosis with metabolic compensation. Now we have a pH of 7.36. That's below 7.4. We put an arrow down. Congratulations, we've determined the imbalance is acidosis. Now that we know it's acidosis, we look at the respiratory and metabolic gases and use the acronym ROME to determine if it is a respiratory or metabolic imbalance. The PaCO2 is 31. The normal range is 35 to 45, so 31 is low, put an arrow down. The HCO3 is 19. Well, the normal range is 21 to 28, so 19 is low, put an arrow down. Now we use the acronym ROME to determine if it is a respiratory or a metabolic problem. The metabolic gas is going the same way as the pH, so our interpretation is metabolic acidosis. Now let's check for compensation. We've already determined it's metabolic acidosis, so we'll look at the respiratory gas to determine if compensation is occurring. There is respiratory compensation because although it is not a respiratory problem, the respiratory gas is not in the normal range. Remember, if it was a respiratory problem, the respiratory gas would have gone opposite the pH. Congratulations, you've determined that the imbalance is metabolic acidosis with respiratory compensation. Now we have a pH of 7.49. That's above 7.4, we put an arrow up. Congratulations, we've determined the imbalance is alkalosis. Now that we know it's alkalosis, we look at the respiratory and metabolic gases and use the acronym ROME to determine if it is a respiratory or metabolic imbalance. The PaCO2 is 55. Well, the normal range is 35 to 45, so 55 is high, we put an arrow up. The HCO3 is 33. Well, the normal range is 21 to 28, so 33 is high, we put an arrow up. Now we use the acronym ROME to determine if it is a respiratory or a metabolic problem. The metabolic gas is going the same way or equal as the pH. Your interpretation is metabolic alkalosis. Now let's check for compensation. We've already determined it's metabolic alkalosis, so we'll look at the respiratory gas to determine if compensation is occurring. There is respiratory compensation because although it is not a respiratory problem, the respiratory gas is not in the normal range. Remember, if it was a respiratory problem, the respiratory gas would have gone opposite the pH. Congratulations, we've determined that the imbalance is metabolic alkalosis with respiratory compensation. Let's consider full or partial compensation. As we know, when one system is out of balance, the other system may try to compensate in order to bring the blood pH to a more optimal level. Sometimes the system is able to partially compensate. This means the pH is not in the normal range yet. Sometimes the system is able to fully compensate. This means the pH is in the normal range. Now let's practice. We have a pH of 7.43. This is above 7.4. Put an arrow up. Congratulations, you've determined that the imbalance is alkalosis. Now we need to check the other gases. The PaCO2 is 30. The normal range is 35 to 45. So 30 is low. Put an arrow down. The HCO3 is 19. The normal range is 21 to 28. 19 is low. Put an arrow down. Using ROME, our interpretation is respiratory alkalosis. We notice that although it is a respiratory issue, the metabolic gas is not in the normal range because it is compensating. We have identified respiratory alkalosis with metabolic compensation. If compensation is occurring, look at the pH to determine partial or full compensation. If the compensation is occurring and the pH is in the normal range, it's fully compensated. If the compensation is occurring and the pH is not yet in the normal range, it is partial compensation. Is the pH in the normal range of 7.35 to 7.45? Yes, the pH is in the normal range. Congratulations, you have correctly interpreted these labs as the acid-base imbalance, respiratory alkalosis with full metabolic compensation. We have a patient with a pH of 7.48. That's above 7.4. Put an arrow up. Congratulations, you've determined the imbalance is alkalosis. The PaCO2 is 27. Well, the normal range is 35 to 45. 27 is low. Put an arrow down. The HCO3 is 15. The normal range is 21 to 28. So 15 is low. Put an arrow down. Using Rome, our interpretation is respiratory alkalosis. We notice that although it is a respiratory issue, the metabolic gas is not in the normal range because it is compensating. We have identified respiratory alkalosis with metabolic compensation. If compensation is occurring, look at the pH to determine partial or full compensation. If the compensation is occurring and the pH is in the normal range, it's fully compensated. If the compensation is occurring and the pH is not in the normal range, it's partial compensation. Is the pH in the normal range of 7.35 to 7.45? No, the pH is not in the normal range. Congratulations, you have correctly interpreted these labs as the acid-base imbalance, respiratory alkalosis with partial metabolic compensation. Some more practice labs. We have a pH of 7.37. That's low. It's below 7.4, so put an arrow down. Congratulations, you've determined that the imbalance is acidosis. The PaCO2 is 30. That's below the normal range of 35 to 45. 30 is low, so put an arrow down. The HCO3 of 19, that's low. The normal range is 21 to 28, so we're going to put an arrow down. Using Rome, your interpretation is metabolic acidosis. We notice that although it is a metabolic issue, the respiratory gas is not in the normal range because it is compensating. We have identified metabolic acidosis with respiratory compensation. If compensation is occurring, look at the pH to determine partial or full compensation. If the compensation is occurring and the pH is in the normal range, it's full compensation. If the compensation is occurring and the pH is not in the normal range, it is partial compensation. Is the pH in the normal range of 7.35 to 7.45? Yes, the pH is in the normal range. So congratulations, you have correctly interpreted these labs as the acid-base imbalance metabolic acidosis with full respiratory compensation. The pH is 7.33. We put an arrow down because it's below 7.4. Congratulations, you've determined the imbalance is acidosis. The PaCO2 is 29. The normal range is 35 to 45, so this is low, so we put an arrow down. The HCO3 is 18. We know the normal range is 21 to 28, so 18 is low. We put an arrow down. Using Rome, our interpretation is metabolic acidosis. We notice that although it is a metabolic issue, the respiratory gas is not in the normal range because it is compensating. We have identified metabolic acidosis with respiratory compensation. If compensation is occurring, we look at the pH again to determine partial or full compensation. If the compensation is occurring and the pH is fully in the normal range, it is fully compensated. If compensation is occurring and the pH is not in the normal range, if it's past the line, it's partial compensation. Is the pH in the normal range of 7.35 to 7.45? No, the pH is not in the normal range. So congratulations, you have correctly interpreted these labs as the acid-base imbalance, metabolic acidosis with partial respiratory compensation. Here's some helpful hints for the metabolic system. The stomach has acid, also known as hydrochloric acid. Vomiting or suctioning causes the patient to lose acid. If you lose your acid, you become more basic. So prolonged vomiting may cause too much acid to be lost, which results in alkalosis. Vomiting is a metabolic problem, which results in metabolic alkalosis. Remembering below the waist is your base can help you determine what acid-base imbalance to expect. Intestinal fluid lost through diarrhea means you've lost your alkaline fluid, you've lost your base. When you lose your base, you have more acid and are at risk for acidosis. If it is a metabolic issue, the metabolic gas goes equal or the same way as the pH. Here are some respiratory helpful hints. Your lungs control CO2, and CO2 we're considering an acid. It's an acidic respiratory gas. If you have impaired gas exchange where you retain CO2, depressed respirations, or a condition such as COPD, you are retaining too much acid, CO2. This puts you at risk for respiratory acidosis. If you're hyperventilating and you lose too much acidic CO2, this puts you at risk for respiratory alkalosis because your respiratory system lost too much acid. If it is a respiratory issue, the respiratory gas goes opposite the pH. Let's try some labs with specific scenarios. If your patient has diabetic ketoacidosis, well, that's acidosis from ketones in a diabetic. It's in the name, it's acidosis. In this case, our pH is 7.31. That is below 7.4. I put an arrow down. I know it's acidosis. DKA is a metabolic problem, and Rome tells me if it's a metabolic problem, the metabolic gas will go equal or the same way as the pH. In this case, the respiratory gas is normal. There is no compensation. Now let's try it with compensation. If we have a pH of 7.36, we know that's down, that's acidosis. We know it's a metabolic problem. Send the metabolic gas equal or the same direction as the pH. If we have compensation, the respiratory gas will be off. Well, we can't put the respiratory gas up because if you do, you turned it into a respiratory problem. And DKA is not a respiratory problem. It is a metabolic problem. So if the respiratory gas is off, it will also go down. Now we look at the graph to determine if it's full or partial compensation. Is the pH in the normal range? Yes, it is. Then it's fully compensated. In this case, we have metabolic acidosis with full respiratory compensation. Let's try this if our patient has COPD. We have a pH of 7.33. My patient has a condition where they retain CO2, which is an acid. They're going to become more acidic. COPD is a respiratory problem. Rome tells me the respiratory gas will go opposite the pH. And the HCO3 is normal. I put a 0. I already know we have 0 compensation. Let's try labs with compensation. We have a pH of 7.37. That's low. It's acidosis. It's a respiratory problem. We know the respiratory gas is going to go up. With compensation, I know the metabolic gas will be off. I need to put that up as well, because if I put it down, I would have two things going on. I would have the respiratory gas going opposite and the metabolic gas going the same way. So I know the metabolic gas will be off, but I'm going to send it up. I'm going to have an arrow up. I'm going to look at the graph to determine if it's full or partial compensation. In this case, 7.37 is fully within the lines, it's fully compensated. If our patient has vomiting, your stomach has hydrochloric acid. When you lose your hydrochloric acid, you become more basic. The pH is going to go up at 7.48. Vomiting is a metabolic problem, and Rome tells me if it's a metabolic gas, the metabolic gas will go the same way as the pH, so I'm going to put that arrow up. And a PaCO2 of 42 is normal. With the 0, I know I have 0 compensation, so we have metabolic alkalosis without compensation. Let's try it with compensation. We have a pH of 7.46. That's high. It's alkalosis. Vomiting is a metabolic problem, so I know the metabolic gas is going to go up. The respiratory gas will be off as well because it's compensating, but I can't put it down because Rome tells me that would be a respiratory problem, and vomiting is not a respiratory problem. So I know the arrow is going to go up. I'm going to look at the graph. Is 7.46 in the lines? Well, no, it's not. It's past the line, so we have partial compensation. So in this case, I have metabolic alkalosis with partial respiratory compensation. If our patient has hyperventilation, in this case, they have a pH of 7.51. That's alkalosis. I put an arrow up. Hyperventilation is a respiratory problem, so I anticipate that the respiratory gas, the PaCO2, will be down. In this case, at 28, it's low. I put an arrow down. An HCO3 at 25 is not high, not low. It's normal. I put a 0. I know I have 0 compensation. Let's try this with compensation. The patient has a pH of 7.46. That's high. I know it's alkalosis. Hyperventilation is a respiratory problem. I anticipate that the respiratory gas will go down. At 30, it's low. I put an arrow down. The metabolic gas is down too. That means we have compensation. Remember, if it's a metabolic problem, the metabolic gas will go the same way as the pH. In this case, it doesn't. So we have respiratory alkalosis with metabolic compensation. We look at the graph to determine if it's full or partial compensation. At 7.46, it's past the line, it's partial compensation. We have respiratory alkalosis with partial metabolic compensation. If our patient has diarrhea, below the waist is the base. If you lose your base, you become more acidic. With a pH of 7.33, which is below 7.4, I put an arrow down. I know it's acidosis. Diarrhea is a metabolic problem. Rome tells me if it's a metabolic problem, the metabolic gas will go the same way as the pH. At 19, the HCO3 is low. I have an arrow down. A PaCO2 of 38 is normal, not high, not low. I put a 0. I know I have metabolic acidosis with 0 compensation. Let's try that with compensation. With a pH of 7.37, it's low, it's acidosis. Diarrhea is a metabolic problem. I know the metabolic gas is going to go low. At 20, that's low. I put an arrow down. A PaCO2 of 32 is low. Rome tells me if it's a metabolic problem, the metabolic gas will go equal or the same way as the pH. In this case, we have metabolic acidosis with respiratory compensation. I look at the graph to determine if it's full or partial compensation. With a pH of 7.37, it is fully within the lines. It's full compensation. If our patient has broken ribs, this will impair breathing. They will have impaired gas exchange and be holding CO2. With a pH of 7.34, I know it's acidosis. I put an arrow down. Again, they're holding PaCO2. Rome tells me that the respiratory gas would go opposite the pH. In this case, at 53, it's up. I put an arrow up. An HCO3 at 26 is normal. I put a 0. I know I have respiratory acidosis with 0 compensation. Let's try this with compensation. A pH of 7.39 is below 7.4. Put an arrow down. It's acidosis. This is a respiratory problem. They're holding CO2. I anticipate an arrow up, and at 50 it is. I put an arrow up. An HCO3 of 30 is outside the normal range. It's up. Well, Rome tells me if it's a respiratory problem, the respiratory gas will go opposite the pH. If it's a metabolic problem, the metabolic gas will go equal or the same way as the pH. In this case, the respiratory gas goes opposite the pH. I know it's a respiratory problem. My patient has respiratory acidosis with metabolic compensation. I look at the graph to determine full or partial compensation. With a pH of 7.39, it is fully within the lines. We have full compensation. Before we draw for an arterial blood gas, or an ABG, we need to do Allen's test. ABGs require an arterial blood draw, most often from the radial artery. Well, the arteries supply oxygenated blood throughout the body, and for the radial artery, in this case, it supplies it to the hand. When drawing blood from an artery, it is possible to damage the artery, which would decrease blood flow to the hand. It's important to determine if the ulnar artery can supply enough blood flow to the hand in the event the radial artery is damaged during the blood draw attempt. To determine if the ulnar will supply adequate blood to the hand in the event the radial artery is damaged, we put pressure on the patient's ulnar and radial arteries. We have the patient open and close their fist several times, and we'll notice the palm blanches or turns white. While keeping pressure on the radial artery, release pressure from the ulnar. If the ulnar artery is sufficient to supply blood to the hand, you will immediately see blood flow return to their palm as it turns pink again. Please note that this presentation is a brief overview only and is appropriate for review and continuing education. The care and treatment of ABG imbalances involves more than this presentation covers. Your patient may also have comorbidities with different types of imbalances. Thank you for your attention. Now go read some ABGs.